Good morning, everybody. Thanks for being here this morning. I'm John Truzino. I'm the Executive Vice President, Chief Business Officer, and Chief Commercial Officer at Novavax. And I'm here today to talk about a variety of interesting topics. I have over 25 years of vaccine industry experience, both from a development perspective, from a policy and distribution. And so looking forward to today's conversation. So participating in Aspen is a first for us. And we're here to make sure we leave no stone unturned by focusing not only on delivering our vaccine, but engaging in conversation about what we can do and what we can do better. A little bit about Novavax. I won't make this a Novavax commercial, but I think it's important to understand perspective of what our company is doing. We are a vaccine company with over 20 years of vaccine experience. We're an innovator, and I think that's important for everybody to understand, right? So this is a company that has spent the last 20 years developing its vaccine platform technology that can be applied to multiple pathogens. Not only have we had our success with COVID, I think it's dominated our lives for the last couple of years, and we feel honored and privileged to be able to do that and be able to contribute to helping prevent the pandemic. But in that regard, we're approved in over 41 countries around the globe. Awaiting our emergency use authorization in the US, but excited for that to be coming soon as well. So this is all of what brings us here, to continue our tireless efforts to identify solutions to some of the remaining barriers and to approach and learn about the lessons learned and to improve things for the future. And to have that conversation with some of the brightest minds in healthcare industry, our panelists. The title of this panel today is Getting Through the Last Mile and Coming Together to Make Vaccines Make a Difference. So we talked a lot about this in preparation. You know, what does the last mile mean? And I think it means a little bit different things depending upon the context. So we're a vaccine developer and we're engaged globally. And I think global meaning of last mile has a slightly different connotation than last mile connotation in the US. But let's kind of break it down into how do we make sure that vaccine gets to where it needs to be, and how do we make sure that there is access to the vaccine that's available and do that in a very equitable way. So that'll be the context of our conversation today. For those of us in the vaccine industry, the public health role of vaccination is preventing serious infectious diseases is clear. And I think that's important to understand too, right? This is about the prevention of serious aspects of the disease. What we know is going to happen with COVID is that the virus is going to continue to circulate. So the game is not over, you know, when the pandemic ends. There's still a lot of work to do. There's still a lot of work to do regarding vaccine access and a lot of things to do about distribution of vaccines. So there's much more to come. So this conversation, in some ways, is just beginning. So although, and this is a little bit of my background, I'm sure some of yours as well, you know, although we've talked a lot about influenza pandemic preparedness, there hasn't been as much work that was really done from a pandemic preparedness as we'd like to think was already in place. So COVID put this question to the test. And in some ways, I think it was miraculous of what some of the accomplishments were. And in other ways, we could have done a lot better. So we're going to talk about some of those things today. So now we're getting close to the questions and panel conversation, but we're going to talk about what all that means. But let me introduce you to our panelists. So first of all, we have Dr. Lauren Smith, Chief Health Equity Officer at the CDC Foundation, Dr. Darrell Gray, Chief Health Equity Officer at Anthem, and Lori Rose Benson, Executive Director and Chief Executive Officer of Hip Hop Public Health. And I'm dying to hear more about what hip hop public health actually means, and I think Lori will be more than happy to talk to us about that. So before we get started, I'm going to give each of them an opportunity to tell us more and tell you all a little bit more about themselves. So Lauren, why don't you start?
Great. Well, thank you so much for inviting me to participate, and thank you all for coming to hear this conversation. I am a pediatrician by training and a former public health official for the Commonwealth of Massachusetts, and I'm thrilled to have joined the CDC Foundation as the Chief Health Equity and Strategy Officer almost 2 years ago. The CDC Foundation, for those of you who aren't familiar, is a nonprofit specifically organized to support the goals of the CDC, which is to promote the health and well-being of communities and populations in the U.S. and around the world. So very excited to be here to have this conversation.
Okay, next, John, thank you so much. And it's such a wonderful pleasure to be here with all of you and everyone here today. Lori Rose Benson with Hip Hop Public Health. It's a mouthful. We are a nonprofit that harnesses the transformative power of music, art, culture, and the science of behavior change to deepen health literacy, to inspire positive health behaviors, and ultimately achieve health equity in communities of color. My background is very much in the education world, in the public health world, and very, very focused on social justice and health equity.
And I'm Darrell Gray, a physician and public health practitioner by training. I have the distinct pleasure of serving as Chief Health Equity Officer at Anthem. Anthem is a large health insurer with a bold purpose to improve the health of humanity. We get to serve over 45 million people across the United States. We have over 90,000 associates or employees that work with us. And so this work and this conversation is not only directly related to those whom we serve, but those who help to amplify our own mission, our employees. So I'm really excited about this conversation. So thanks for having me.
So what a great cross-section we have here of panelists, kind of representing a real mix of perspective on the conversation we're going to have today. So why don't we get started? And collectively, we've delivered multiple vaccine options and administered billions of doses globally. There have been a lot of successes, yet we still have a lot of work to do. So with this in mind, I'd like to ask each of you the same question from your perspective. What are the challenges that we still face to ensure vaccine uptake and equitable access? So,
it's a great question. I think it's important to frame it in that way, that although there's been substantial successes, we still have challenges that we need to face to address things now and to make sure that we're well positioned to continue to address these issues going forward. So I can think of, four, and I'll just sort of briefly mention those and then we can riff. One is the extensive and excessive, I would say, mis and disinformation about vaccines that are prevalent in our communities and across, so many different platforms. For any of you who were just at a prior conversation, we were talking about mis and disinformation, and so that's one. The second is, I would call it pandemic fatigue, or just being over it, and so just kind of tuning it out. The third are the continued structural barriers that cause problems in the first place and are, continue to be there. So those are three. I'll stop there, but those are the ones that come top of mind to me.
So everything that you said are things that we think about all the time at Hip Hop Public Health, but I feel like it's important to just kind of get you in this musical mood for a moment, if I may. So, there are very few things from our perspective that can really, be sticky or arouse like music, right? You know what I mean? I could see that, see some heads nodding. Think back to a moment earlier in life, like maybe that first kiss, that first date. You're thinking about it, Darrell, I could tell. And that song, that soundtrack that plays, and then if you hear that song, you know all the words. You don't even know that you know all the words, right? And so when you think about how music can inspire, it can energize, it could also soothe and be stress relieving, right? And so music is really central at our approach to health literacy and health behavior change. And then when you couple it with some cultural competency around particular musical genres, you could really create those deep emotive connections. And so when we think about, the central focus of what we're doing in terms of combating mis and disinformation, combating a lot of the rumors that are out there, and kind of in a positive way, really engage folks to take it to that next level, bit by bit, along a pathway of behavior change. I would add that if our founder, Dr. Olajide Williams, was here, he's a neurologist and a professor, and actually our other founder is Doug E. Fresh. For those of you that are not hip-hop adjacent, he is I've created that term, I think. He is the beatbox, the original OG beatbox inventor, and he's one of the guardians of the hip-hop genre that's actually turning 50 next year. But what Dr. Williams would say if he was sitting here, he'd say that music occupies more neural real estate in our brains than language itself, right? The way we can recall, the way we can learn, the way we can connect emotively with content that advertisers and marketers use so well, right? To get us to do the things we don't need to do or maybe shouldn't do or buy the things we don't need. But why don't we use that more for public health? And so, what I can bring to this conversation today are some of our maybe not so typical public health approaches, but based in public health to really combat a lot of the issues that we're facing, and particularly connect with communities in a deep and meaningful way.
And John, I think, it's interesting. The way you frame the question, I think, is spot on, because I think some of the bright spots of the pandemic also mirror those of the ongoing challenges. And what I mean by that is, some of the bright spots we saw were how communities were engaged and how, for some communities, we shifted from vaccine hesitancy to vaccine confidence, from lack of access to them getting access and utilizing and getting vaccines. But that still reflects some of our ongoing challenge for some communities. And I think that also reflects our ongoing opportunity. And if we are going to be effective in this space, it's really going to be through partnerships, and not just, our individual organizations or companies partnering with communities, but yes, centering the community, but partnering across industries, partnering, with pharma, partnering with nonprofit, partnering with foundations, partnering in the payer and health system space. And so it sounds easy, but that is a challenge. That kind of partnership and how we can work best together to accomplish what we're all trying to achieve.
Yeah, so this is great. I think this is a great way to kind of tee up what the problem is. So there's a problem statement here. The problem statement is, we have this misinformation, right? Maybe I'll relate it to noise, right? Because it's not helpful, right? And then there's a vehicle by which we communicate, because I think we're going to talk about communication solutions in the next question. But so where do people get their information from today? Right? What is the infrastructure that exists for information? And then we're talking about kind of a payer infrastructure, right? Which is a big piece of what Anthem does, not the only piece, but a big piece of what Anthem does. So people need to be comfortable with that payer side. Who's paying for the vaccine? Mm-hmm. So I think with that in mind, maybe a little bit more commentary on what's the right tee up from these infrastructure pieces, right? Let's talk about the problem statement from infrastructure, and then we'll talk about solutions from a communication standpoint.
Yeah, I can start. For us, when our members or our consumers and those whom we serve do better, we do better as an organization. And so as I think about, vaccine equity, we really are striving towards that. And it's not just a moral and social imperative, it's really a business imperative. And so as we think about how we make vaccines more accessible, how we speak the language of people, we have to be in those spaces, and thankfully we are. From barbershops to partnering with Boys and Girls Clubs to partnering with American Lung Association and so on, to be able to be that voice proximal to the community where people are. And so from a payer perspective, and people may not expect this, we really truly are in communities, and we have to be, and we should be if we really want to advance equity.
Just to pick up off of that, I wanted to just share that I just so agree with what you're saying. And one of the approaches that the CDC Foundation took in responding to this pandemic was through a focus, an intentional, conscious focus on supporting community-based organizations as the kind of influences in the community, as the trusted sources of both information and conversation, where people go and to meet people where they are, the barbershops, the beauty salons, the laundromats, all the different places where people spend their time, and to build those relationships or to enhance those relationships so that those community-based organizations are really part of the public health fabric in their communities, because those things have to be in place to build on the other outreach, education, and other kinds of infrastructure points that we're putting. But that was a very conscious effort that we undertook in focusing our work.
So playing off that a little bit, Lori, let's
Yeah.
talk about, from the theme of music, right? Is there some people that love to listen to their music and some people that don't? And so how do we leverage, right, the various demands or opinions of people where they get that information? I think you're zeroing in on that from a very technical and scientific perspective, which is interesting.
Yeah, well, we also believe that people closest to the problem are closest to the solution, right? And so when we're creating resources, and we also believe it's music, but it's also multisensory, so if there could be dance involved, if there could be audiovisual, like the more senses we can ignite, the more chances we'll have retention for learning, and then perhaps steps towards behavior change. I would say a really good example is really being in that community and connecting with young people. And young people for us are at the center for a lot of the communication. So I think this also answers your question about structurally. So we work a lot in the K through 12 space and in organizations that support young people and teens, because we really believe that young people can be the conduits to their families and their communities. And they are the trusted messengers, right? We've heard over and over, we were talking about this as we were meeting and greeting yesterday, right? So many young people want to take care of their grandmother, take care of their abuela, right? They don't want to get them sick, right? We know that the youngest in our families take care of our younger siblings. So when we think about young people as the conduits, we call it child-mediated communication health model. It's a little wonky, and it really works. And so how do we build that infrastructure, right, to create resources, and then we create wraparound tools for teachers, for parents, for families, really targeted resources, so that can be inserted into education during the school day, after school, and programs like Boys and Girls Clubs and YMCAs, but also thinking about how young people, from a structural perspective, can adopt and adapt that, right? So if communities, if young people are living on social, and they're getting their information from social media, how do we give them the agency over this content so they have the knowledge, but then they can share it out? They can add their little tweak to it. They could add their own verse to the song when they know the right facts, right? It's all about the facts. So, using those conduits and using young people to really harness communities is a big piece of sort of the structural component and also the messaging component as well.
Let me just add another little perspective before we head off on to the next question, because I think there's another infrastructure comment here that's layered into these commentary that you have. So we're talking about COVID. We're also talking about other vaccines. COVID distribution in the very beginning when vaccine was available was a challenge, right? Where do people go to get vaccinated? 15 years ago, if we had this pandemic, there would be no vaccinations at pharmacies. Today, we have almost, every pharmacy in the country is providing vaccinations, I think, which is critical, which is great, another outlet. But I think, I'm not sure that everybody is familiar with the fact that during the pandemic, we had this precipitous drop, and I think, Lauren, we talked about this, in normal routine pediatric vaccinations have dropped off more than half over that period of time because we didn't have an alternate access point or way of communicating to make sure the kids got those routine vaccinations. So I think we got to consider the implications of that as well. So coming out of the pandemic, we need to think about coming out of the pandemic and going into what will be an annual revaccination program of some sort, because this virus is not going away. We got to consider those other implications as well.
Well,
so with
John,
please go ahead.
To your point, and sort of echoing what Darrell said, that ecosystem, right? The way that if you have infrastructure and you have folks that can create the messaging that's tailored and exciting with trusted messengers, and then organizations that can also fund efforts that, like, we would never have been able to do so much of what we've done. We were not a vaccine organization. We were all about health promotion and disease prevention, physical activity, nutrition, but we felt it was so important to focus on health behaviors around vaccines. And so when CDC Foundation put out this RFP for arts organizations to harness public health, to really connect deeply with communities, that helped us to be so nimble. And so to be able to have this ecosystem, and everyone out there, we need to partner together in this incredible collective impact way so that for the next thing, the next pandemic, or even reminding folks about general getting checked regular checkups, regular vaccinations, getting on track, like using those channels that we've built in sort of this new way to continue with all of the health promotion, disease prevention, and really healing during this, interesting time that we're living in.
Yeah.
And I'll just add to your points, I think, and this is not my quote, but people have said change happens at the speed of trust. And if we are going to be that kind of trusted partner, then we can't take this siloed approach to vaccines or physical health. We have to take this whole health approach. So addressing social barriers that can, to your point, prevent people from accessing and utilizing vaccines, behavioral health barriers, pharmacy barriers that they may experience. So you can imagine for that person who, for their priority, it's food security. Their priority may be transportation to be able to get their kids to school or get to the grocery store. If we're not addressing those things, they're not necessarily going to hear us or partner with us to get vaccines.
Right.
And that's what you were talking about yesterday.
Yeah, no, we talked about what are the competing life priorities that families experience so that, yes, they may want to get a vaccine or know that it's important, but they have, other fish to fry before they get there. And many of the community-based organizations that we were so excited to partner with were working in those kinds of spaces, and so really took a holistic approach of seeing individuals and their community as complete and full humans who had a full life around that included all sorts of other things besides, getting the shot in the arm. And I think that seeing them that way and having the community leaders and influencers be able to reach out to them in that way, recognizing what those other competing priorities were, then created the space, as you said, allowed them to then be able to hear. And this was, really concrete things, organizations, working at children's museums or working with faith-based communities, a whole host of things. People are incredibly creative to do exactly what you were saying.
So we've snuck up on question 2 already, which is great. And so I think what we've been talking about is the challenges that we face. And we've talked a little bit about some of the solutions, but maybe let's dive into that in a little bit more specific way, because there's so much compelling evidence as to why vaccines are important, why vaccines are effective, why vaccines are safe, yet there's so much negative information out there, disinformation out there about vaccines that we now have to combat. So now we have to figure out, we can complain about it if you like, or we could do something about it. So in that context, my very specific question, one of the themes we're hearing at Aspen is the need to educate with accurate and timely messages about the value of vaccines in preventing disease. I'd like to hear from you all about how we can improve in this regard to bolster vaccine confidence.
So I would start by having us think and be able to tap into the evidence and the data about how people make decisions and what actually influences their behavior. Because I think sometimes in public health, we have a sense if we just give people the information, then they'll check all the, get through all the other spots to be able to then have the behavioral outcome that we're looking for. And decision-making and behavior is not logical, it's not linear, and being able to recognize who and what and how actually influences what people do is such a key part of what has to happen to be effective. And I think the community-based organizations, the arts programs, that, like what you did, we're using that data. And we do have science about what influences behavior. We just have to sort of harness it for this purpose.
So let me just follow up on that, if I may. So the CDC has all these amazing resources, all of this data. They've been very effective in their communications campaigns over the year. Yet there's still this either vaccine hesitant or anti-vaxxers out there. And in some degree, I'll take the issue head on, that there's been some partisan, right? We want to take the politics out of it. So how do we take the politics out of it, focus on the scientific information, focus on what's important, and get people to pay attention so it becomes a bipartisan issue?
Well, I want to, and I'll be quiet after this, but one of the big ideas from the first evening was the gentleman who talked about seek to understand first and not to sort of pull people to your pole of where you are. And I think that is underneath a lot of what you all are doing, and what the folks that we partnered with are doing is what are the concerns, many of which are valid. Some have been stoked by mis and disinformation, but there are valid concerns, or how can you respond to those in particular to be able to sort of gain the trust and allow people to feel that they're being heard and not dismissed?
Mm-hmm. I mean, I'll give you a specific example of the work that we did. When we started, looking at behaviors to prevent and mitigate COVID, of course, hand washing was the first thing. We were creating resources in English and Spanish, and then mask wearing. And then when it came to vaccine literacy, we realized we couldn't just create one resource. There were many different reasons why people would be excited about or not excited about participating in vaccination. And we called our, it's not really a campaign, but a campaign educational resource series, Community Immunity. Immunidad Comunidad, right? So it's all about us, not about me, it's about we. And then when it came to creating resources, we broke it down, because we're hip-hop public health, we gotta break it down. And we broke it down to these very small bites. After doing lots of focus groups in different communities, with young people, with families, with intergenerational households. So we broke it down into literally 1-minute bites. So addressing, historical mistrust of the medical system was one. Addressing mis and disinformation was another. Addressing what are the side effects? And as science would evolve and things would change, we'd have to add more. So we started with 4 songs and videos, then it was 5, then it was 6, then it was the variants, right? What's the deal with the variants? And then when teens were able to get the vaccine, and we all knew that teens were so much more mobile than everybody else, that's when we applied for the CDC Foundation grant, and we created Teen Takeover Community Immunity. And then we worked with teen artists. We created a national version, but then we worked specifically in Baltimore to focus on Baltimore. So the video that we created for Baltimore looks different than the national version. The Be More, I'm a New York City girl, so Be More is a little bit different, but we had to learn, right? And we had to talk with people on the ground and with people and with communities. So creating this really tailored, culturally tailored, fact-based. We once had a video that talked about you either get 1 shot or you get 2. We had to change that, right? As things evolve. So being responsive from that messaging standpoint was really exciting for us, and continues to be as now younger people, right? Our littlest school-age children can be supported. And I think the last thing I would just like to say about this is, how do we help, when I think about the K through 12 population, how do we help teachers do a better job at this? Because it's a tricky conversation to have. So we made it easier. We created lots of wraparound lesson plans, explainer videos, things that can go home with families, so the teachers aren't just talking about, okay, get the vaccine. Especially teens don't have that autonomy there. But it's about, let's think about yesterday. If it's raining outside, right? You might have one of those lovely umbrellas. Thank you, Aspen Institute, for having umbrellas from place to place. And you might have a raincoat, but you still might get a little bit wet, right? So understanding the continuum of coverage and continuum of support that vaccines can provide, but then all the other health behaviors that we don't want to forget about, and just focus on that.
And let me just tee it up for Darrell a little bit, because I think there's a very specific question I want you to address. You've got 2 terrific motivators for wanting to be effective in your communication to your covered lives. Yeah. Certainly public health is a primary mission, but you're a payer, so there's a little bit of a financial motivation in there. I don't think that's a bad word, but there has to be a outcome benefit to what we're doing. An outcome benefit is the prevention of serious disease, is the hospitalization, is the long-term consequences of having that disease. So you have 2 significant motivation factors. So talk more about that. How that manifests itself.
Yeah, absolutely. And I think to be able to get to the outcomes that you mentioned, we have to do exactly what they were saying. We have to do better at listening. When you both were speaking, it brought to mind, for me, a scriptural reference that says, be slow to speak and quick to listen. And I think, what we've learned is that we not only have to kind of listen first, as opposed to going out with a prescribed plan, but we have to listen, adapt based on what we hear and learn, and then act. Don't stop at the listening and learning, but then act. And so as I think about, John, just what you said, the outcomes, it's going to be because we listened, we learned, and then we acted. And that has to be reflected in our messaging. We have to use that information to change our approach. And our approach may be different for different populations. That's another thing that's critically important, is that we can't use, it's not a one size fits all. As we think about health equity in COVID access and COVID vaccine access and utilization, it's not a one size fits all. And we learned that. Matter of fact, we did a research study. It was led by Dr. Shantanu Agarwal, Chief Health Officer, and Dr. Mark Overhay. And we sampled our Medicaid and Medicare population. And trying to get this was early in the pandemic, perceptions around COVID-19 and vaccination. And what we learned was that those who were most kind of socially vulnerable actually had just as much intention, actually had more intention to get vaccinated than those who were not socially vulnerable. We also learned that those who declared they did not intend to get the vaccine, it was because they had safety concerns. And so our approaches to those populations are different, and that's the way it has to be, even at a payer lens. Yep.
So related to this, and in the theme of the last mile, we talk about equitable access. So there's equitable distribution, making sure vaccines in total supply get to where they need to be, again, on a global basis, different than in the US. But ultimately, the vaccine has to get into somebody's arm, right? And the person has to be vaccinated. And so how do we make sure that even though we have vaccine availability, which we do, that people have access to that across the spectrum, through whomever, whether it's in a poorly underserved community or a black or brown community or just a rural community or and so indigenous population. So how do we, with all of your tools available, how do we make sure that that's happening?
Yeah, I think, it first has to start with that relationship piece I was mentioning first. We have to be in more spaces to create more trusting relationships with communities we serve, whether it's in rural America, urban America, whether it's amongst our American Indian population, Alaska Native population, whether it's African American, Hispanic, Latino. We have to be able to create those spaces for the change to happen. And I think when we create those spaces, we also have to be able to be willing and invested in navigating barriers to access, whether it's the transportation to get to the pharmacy, to get the vaccination, or having access to that trusted primary care provider to provide that vaccination. I think we all have to be a part of that barrier navigation process. Yeah.
Yeah.
I would, it's looking for other kinds of partnerships. So I'm thinking about the transportation barrier. Some of our community-based organization partners works with employers in business to be able to have sort of on-site or close to on-site vaccine opportunities, because many people work in jobs that don't have the kind of work flexibility to be able to take time off to go get vaccinated. So, and many in the business community saw an aligned sort of shared value in ensuring that their employees were vaccinated, so they would have decreased, numbers of people out and be able to have continuity of their productivity. So I think that those kinds of partnerships and identifying a shared agenda and mutually beneficial ways of proceeding was something that the pandemic allowed to be elevated. Now it's going to be on us to continue that, to be able to ride that wave, into the future.
Another great transition to the final question, which is how do we collaborate to make all this? And we've touched on this a little bit, I think, I love the idea of barbershops or faith-based organizations, or I just learned today from my CDC colleagues about all of the stuff that the CDC Foundation does. I wasn't aware of that, deploying people out into the communities, into state-based organizations. So I think there's a lot of collaboration that's going on already. What more can we do to bring the power of all of the resources that are available and bring them in sync with one another?
Well, I was just about to talk about collaboration.
It's a great time.
It's almost like we have this level of synergy here, right? It is
spirits.
Right, kindred spirits for sure. The collaboration, the synergy, like creating that hive, right, where everyone has their own superpower, and then can contribute to it. We're not going to be providers, we're not going to be administering vaccines, but we collaborate with many organizations on the ground that were doing that. And we brought our messaging, we brought our swag, we brought our artists, we brought our resources, right? The other thing is everything that we create at Hip Hop Public Health is free. And sometimes they're like, well, what's the catch? You know, when is it not free? And we have over 200 resources, and I just want to throw it out there, hhph.org, Hip Hop Public Health, that schools and families and other organizations can adopt and adapt for their use. As long as it's for nonprofit purposes, you can use this. So, you know, we want to give it away. We want people to like take the idea and run with it and use it and in the best way possible. And I guess the last thing I would say about that is you know, open to collaboration. So many of us in public health, we're very much in our lanes, in our silos. But the more that we can open up and, you know, build upon those unintended positive outcomes of the pandemic, these systems that have been created, like the pharmacy access, like other funders deciding to like invest in other organizations that it never existed before, like even working in the corporate sector. These are all of those, you know, weaving that fabric together, I think is going to continue to help us move forward, whether it's around, you know, COVID vaccines or, you know, any area of health promotion and disease prevention.
And I'll just add, you know, I'll borrow some language from our chief health officer. I think it has to be no wrong door, right? We say no wrong door, whether it's no wrong door to collaboration, such as being in schools, whether it's no wrong door through disseminating health information, whether it's through digital platforms or otherwise, or being on the ground in the community. That's what we can do for collaboration across industries. And you brought up the school example. I mean, you brought up other community examples, being in salons, for example. That's how we can partner, I think. You partner with, whether it's with Novavax, Hip Hop Health, Public Health, whether it's Anthem, whether it's CDC Foundation. I think it's finding those people who are invested in this mission and really helping to materialize it. Because people want to help, they don't always know how to help or where to help or resources that are available to help. So I think, you know, in our positions, we're able to educate. And I think that's how we'll continue to be able to collaborate successfully. Yeah.
I hope somebody's taking notes about all these motivational statements that are being made during this panel. I'm trying to keep a collection of them all. But one that we talked about, and I think this is a really important question, is who do we trust, right? Who do we trust for the mission? And I think we have to accept that some people will trust certain groups, some people will not trust, and so we have to find who they will trust in order to be an effective message. I think, Darrell, it was you who said before, I'm not going to paraphrase this the right way. Trust is the fastest path to success or something.
Change happens at the speed of trust.
There we go.
Yep.
So I'd love to hear from each of you. One, CDC is such a powerful force, but yet their messages aren't necessarily trusted, right? They think there's another motivation, right? Just like with, you know, private companies, you know, there's another motivator. So should we trust what they're saying? So how do we find who people trust?
Well, I think that's first, it's a great question, and I think there's layers to the question. So when you think about whether or not the messages are going to be effective, you can think about who's delivering the message, which we can talk about, what the content of that message is. So is it specifically tailored to what the concerns or the issues are of a particular community? I'll give you a quick example. Some of our community-based organizations learned that folks in a particular, you know, refugee and immigrant community were getting information that was incorrect from their home country, and that was the source of the misinformation. If we didn't know that, we wouldn't be able to combat or address the specifics of it. Right. So that's the sort of what's the content is. The how, are you doing it through, you know, multiple channels? Multiple channels always is going to work better because it layers and is, you know, mutually reinforcing. So I think that's going to, and when are you catching them? Is it, you know, incorporated into the church service? Is it on the side of a bus? Is it, you know, stuck in the kid's backpack and it comes home with the information? So all of those layers I think are really important.
Yeah, I mean, we say this all the time. It's the messenger, it's the message, right? It's the moment and the medium and putting that all together. You know, for us, we use hip hop.
I didn't have the 4 M's.
Oh, you could take that. I'm taking Darrell's quotes for the next talk for sure. You know, that's how we adopt and adapt, right?
Right,
And keep growing together, all boats rise, right? In hip hop, when hip hop was born in 1973, it was all about having a way of communication, you know, messaging for the community, of the community. It was all about social justice. I know when I say the word hip hop, there's kind of two sides of hip hop these days, and not all of it is. There's a side that is very misogynistic and not exactly, you know, in the place where we are of sort of the origins and sort of where this kind of grew out of connecting with and for community. And so when you think about that, and the artists that we work with, I mentioned Dougie, but we work with DMC, Darrell DMC McDaniels of Run DMC, Chuck D of Public Enemy, and even, you know, hip hop adjacent folks like in the R&B world, like Ashanti and Jordan Sparks, and actually Cheryl Salt James of Salt and Pepper. She's part of our crew now. You know, they have such leverage within the folks that look up to them, that grew up with them. And they're not the public health experts, but they also can be incredible conduits. And they're not, you know, they're not just, you know, folks that are just a spokesperson. They really, really believe this and use their platform for good. We actually just had a meeting with them last week, all of them. And you know, a lot of times working with artists, they like come late and leave early. It's like we had a room till 10 p.m. and it's 10:30 and we're like, okay, time to, you know, we're good. But they are doubling down on their efforts. DMC put his voice out there with community immunity when so many artists did not want to put it out on social. And even when he started to get like negative feedback, he told his publicist, and for the publicists out there, he said, turn it off. Just turn off the notifications. This is important. I'm using my platform. And so, you know, maybe it's music, maybe it's in you know, athletic arena, maybe it's in civic arena, you know, having all of those levers of those trusted messengers for change. And it's hard work. It's not easy. It's you know, as you said, there's not one size fits all. So if we're going to do something in another language, you can't just translate it. You have to work with different artists and different music and different metaphors and different idioms. So, you know, it's tiresome, important work, but making those nuances and collaborating and supporting the areas where you don't have that superpower and knowing what's not in your lane and where others are really excellent at it, I think is really important for as we, you know, move forward.
I am now totally prepared and excited that the next ACIP meeting will start with hip-hop music. It changes the complete dynamic of how these meetings are going to go from now on. I'm sorry, Darrell.
No problem. I would just add, you know, those of us who are champions, including those who are viewing this, I would just say bring your authentic selves to the conversations. So, you know, certainly I come at this from a lane of being a physician executive, but I also come at this from being a believer. So I have a faith system. I come at it from being a father to 4 kids. I come at it from being a husband almost 12 years. I come at it being a community champion. And so when I approach these conversations, I have to bring that authenticity to it. I may have to take the executive or the physician hat off and to be able to speak the language of those who I'm talking about and make it real. I mean, you know, early in the pandemic or early with vaccine distribution, you know, certainly I got calls from family members. I got stopped in grocery stores by people who I knew in the neighborhood and said, you know, I don't think I want to get this vaccine. Can you tell me why I should? And I had to bring that authenticity to the conversation because they're not necessarily going to trust me per se with my physician executive hat on, but they'll trust me as the neighbor. They'll trust me as the brother. They'll trust me as the son or the grandson. So, you know, I have to bring that authenticity to the conversation.
So I'm going to maybe take a few minutes, flip over the wild card and throw it out to the audience to see if there's any questions for the panelists. It was such a dynamic conversation. We'd love to see if there's any questions or comments. Yeah, please.
You mentioned at the outset the fact that a lot of people have not gotten other regular vaccines during the pandemic. And so it does feel like what you all are saying is we need to meet people where they are and listen to them and try and educate them. But we need to be educating them not just on you need to get your COVID vaccine, but you need to, you know, we're going to have to kind of maybe have a broader campaign or broader thinking of how do we make sure people get on a regular schedule for vaccines writ large? And just is that something that you all are collectively thinking about? Because it seems really important, particularly for a lot of the vaccines that have a key role in people's lives that Novavax is producing.
Well, I would certainly say, as I mentioned at the start, I'm a pediatrician, so I am exceedingly focused on the fact that many kids have gone unvaccinated and that there is a intensifying, well-organized effort to undermine pediatric regular routine vaccinations, which will leave both the kids and their communities vulnerable to vaccine-preventable illnesses that, you know, those of us who are of a certain age or haven't had to see because the vaccines have been so effective. So I think that, so going back to that question about mis and disinformation, we absolutely have to do that, and we have to redouble our efforts of talking about why childhood vaccinations are so important, even though we didn't think we were going to have to do that anymore because they were so taken for granted. They've now been challenged, so we in public health and healthcare, I think, have to go back and sort of come up with ways of communicating just why that is. Because vaccines have been so effective at preventing childhood disease, most people who have young children now have never seen natural disease. And so they don't know they don't have actual experience with what it is that it's being prevented.
But there's another communication opportunity there, right? To remind people of these, you know, serious and deadly diseases that have virtually been eliminated because of vaccine. I'll tell you that there's a lot of attention that I participate in that that is focused on this problem, right? I'm a board member on the Vaccine Policy Advisory Committee for Bio, and it's a very significant, important topic of conversation. Interestingly, it's not getting any media attention. So I think some of these things require a various way of communicating. Maybe one or two last comments, and then I'd like to close it out.
Yeah, you know, last week when we had this off-the-record conversation with our anchor artists, and like what a missed media opportunity, right? We had this closed-door conversation off the record intentionally because we wanted everyone to feel safe and feel heard, and we said we're not posting anything about it. We might take some pictures to commemorate it, but two things came out of that conversation. One was really supporting our community's mental health. And a lot of times it's concerns around mental health that get in the way of going back to the doctor or going to get checked or family history. And then the other thing was about having your annual well visits. All of our artists felt it was so important to double down on that. And that's where the physician can really have that conversation with the young people about the vaccinations. So, you know, being able to, you know, sometimes people are a little bit, you know, tired, you know, pandemic fatigue, hearing about vaccines, but what are the other ways that we can communicate to bring people in and then also take them on this, you know, journey around other areas that are going to support a much healthier, you know, general population and individual, you know, family health as well.
And very quickly, I'll just say yes, we are focused on it, whether it be through our reporting on annual well visits or vaccination. An example is influenza vaccination. We report on it, we're transparent about it, and it's something that we are keenly focused on. So very quickly, yes.
So first of all, thank you guys very much. What a terrific panel. So maybe a little bit of a round of applause for the panel. Such great insight and commentary. So, and thanks to Aspen Ideas for giving us the opportunity to even have this panel conversation. Thank you all for joining us today. I've learned a lot today as well, so thank you all. Let me just also close by saying that Novavax has a kind of an information booth over there by the refreshment stand. If you have any kind of questions about what we do and about our COVID vaccine, then we'd be more than happy to chat with you all. So guys, thank you again very much. Appreciate it.